Brad Dale, physical therapist with Resurgens Orthopedics here to share a few stretches and exercises when your back is bothering you. If you find that these don't work effectively for you, reach out to Dr. Grimm or one of our fabulous physicians to help get you back to the road to recovery. If you're experiencing back pain and leg pain, I'm going to show you two movements that will assist in reducing those symptoms. The first one, lying on your bed or the floor, you're going to position yourself with your heels rotated out, your elbows being pulled into your side underneath your shoulders or your chest, and then you're going to prop yourself up onto your forearms. When you get to the top of the motion, you're going to hold it for a breath or two, go back to the start position, and as you push yourself back up, it is an arm-focused exercise. You will feel the stress in the back. Now, when doing this exercise, if the 10th rep doesn't hurt as bad as the first rep, this exercise is going to be one that you're going to do. Let's take a look at the next exercise. The second exercise, when your back is bothering you and you're having leg symptoms, will be a stretch for the hamstrings. With you lying on your back with both knees bent, you're going to take one leg and you're going to bring it up into the air. When in this position, what you want to focus on is making sure that your ankle is relaxed and that you feel the stretch in your hamstring muscle. When in this position, hold it for 30 seconds, and then you're going to repeat the same movement on the other side. 2 to 3 repetitions after you perform that first exercise will be the key to getting you back into shape. The next exercise in the routine is when you have back pain only and no leg symptoms. Lying on the floor or your bed, you're going to bring the knees up into your chest. When doing this motion, if you don't feel the stretch, you may need to open up your legs a little wider when pulling. We're going to keep this dynamic, which means when you pull, you're going to let a little pressure off after a couple of breaths. You'll pull it back to your chest. It creates a heating effect and allows those tight muscles of the low back to loosen up. You want to do about 10 of these before you see the next exercise in the routine. The final exercise in our series of stretches for back pain only, no leg symptoms, will be on the floor, but for our demo, she's up on my table. It's going to be a hip flexor stretch. So from what we call a half kneeling position, you're going to take your tummy, suck it in, so create a pelvic tilt, and then you're going to shift your weight forward until you feel a pull through the front side of the hip and thigh. When in this stretch, you're going to hold it for 30 seconds, and then you're going to repeat the same movement on the other side. 2 to 3 repetitions on each leg will be sufficient for stretching out your low back and your hip. That's 4 easy exercises and stretches to help get your back pain to decrease. If it does not within 7 to 10 days, reach out to Dr. Grimm or one of our fabulous physicians to help get you on the road to recovery.